Hello and welcome to Docplexus News. Let's go through this week's healthcare headlines that matter. To fight the increasing drug abuse in the country, the National Policy on Drug Demand Reduction will be brought before Cabinet this month. As per the policy, specialist doctors and facilities will treat addicts in all government hospitals. The policy also proposes accreditation of de-addiction centers. All doctors of government hospitals will be trained over next 5 years to treat drug addicts. Gurukul Tragedy and the recent tragedy in Rajasthan clearly demonstrate the immediate need for giving more importance and attention to children's health care in India. The Rajasthan government will be questioned as a consequence of more than 80 infant deaths. The National Human Rights Commission has sought a detailed report in the matter within 4 weeks from the Rajasthan government. The states of Andhra Pradesh and Telangana have decided to introduce a bond of Rs 50 lakh for PG aspirants from other states. Earlier, other state aspirants were not allowed to pursue medical courses in these states. The sources said that the decision was taken to ensure educational and employment opportunities for domiciles of the state. A study by the National Institute for Research in Tuberculosis found that food reduces the effectiveness of 3 first-line drugs, rifampicin, isoniazid and pyrazinamide. When the pills were taken after food, significantly lower plasma concentrations and delayed absorption of anti-TB drugs was observed. Study shows that at least 2 first-line drugs need to be taken on fasting. Generally, patients experience stress and discomfort due to compression applied during the mammogram. However, the new FDA-approved first 2D digital mammography device, the amount of compression applied during exam can be controlled. In this newly approved device, the handheld wireless remote control can be used to control compression after breast positioning. To promote family planning, 2 new contraceptives, namely Andhra injectable and Chaya pill, have been launched by the government under the mission Parivar Vikas. These contraceptives have been launched in 10 states and presently available in medical colleges and district hospitals for free. Both contraceptives are safe and highly effective. The Andhra injectable is effective for 3 months and Chaya pill for 1 week. The government's ongoing plan of allowing AYUSH practitioners to practice modern medicine is now appearing to get into action. The West Bengal government has permitted AYUSH practitioners to prescribe modern medicine with some proviso. The practitioners who are registered under the State Council in West Bengal shall be entitled to practice modern drugs. The Delhi High Court has directed the state government to publicize the names of hospitals that provide free testing and treatment for Hepatitis C. The directives have come on a petition that most patients have been forced to go to the private sector, which charges the high prices. Unlike the West, research institutes in the country are concentrating on research programs while medical colleges on teaching. ICMR Director General Dr. Soumya Swaminathan told that this is not a good situation and there should be combining the research with the teaching and patient care. Now it's time to announce last month's The Top Case Award. For this challenge, Docplexus had requested its community to share a challenging case that will be nominated for Top Case Award. We are happy to announce Dr. Ashok Gupta has received maximum nominations from and hence is winner of this award for the month of August. Dr. Gupta has shared an excellent case where he successfully performed maximum number of complex microsurgical free flaps in one patient. In the wake of recent incidences of child deaths at various hospitals across the country, there is an urgent need to understand the lacunas of healthcare delivery. Docplexus requests its community to discuss the matter and suggest opinion on basic infrastructural needs necessary for better child healthcare. You can suggest your views in the form of posts and the best suggestions will be featured in our upcoming news episodes. These were the latest happenings in the medical field brought to you by Docplexus, India's largest and fastest growing online community of doctors. Stay tuned for more every Thursday at 6 p.m. Happy Docplexing!